Good evening. It's 7:07. Kelly Alexander in for Barry Morgan on the Back Doctor show tonight. Thank you so much for joining us here on CJD. We appreciate it very much. And we'll actually open up the lines right away because I know that we get a lot of calls in with regards to questions for Dr. Jean-Pierre Morissette. So you can join us here at 514-790-0800 by phone and, of course, by text at 514-800. And we're actually joined tonight by another doctor as well. Dr. Jean-Pierre Morissette will be with us in a moment. But we're going to start off actually with Dr. Patrick Freud. Welcome to CJD.
Thank you very much.
Is this your first time on radio, Dr. Freud?
It sure is.
Yay! So baptism by fire. It's going to be great.
This is fun.
So can you tell us a little bit about yourself? I know that you actually are at part of McGill's faculty.
Yeah, I teach anatomy at the Faculty of Medicine at McGill, and I've been a chiropractor now for about 20 years, and I deal especially with neurological conditions.
Oh, okay. And I understand you also you practice in NDG. That's where your practice is specifically?
Yeah, I'm at the Queen Elizabeth Health Complex.
Okay, perfect. So I guess, just before Dr. Jean-Pierre shows up, I wanted to ask you a little bit about why you decided to actually get into being a chiropractor, because that's a very specialized form of medicine.
It is. I've always been interested in the human body. I find it's fascinating. I was doing a degree in anatomy at McGill with the intention of becoming a medical doctor. And one day they had different speakers come in to talk to students in medicine and students in different faculties, and they had a chiropractor speak, and I assisted this talk, and I was really, really amazed at how amazing the profession is. The fact that it really respects the body's intelligence to heal itself, the fact that the practitioner will use his hands to help the body heal. And that really changed my aspirations, and I decided, you know what, maybe I shouldn't become a medical doctor, and I started looking into chiropractic, and I went for it.
Excellent. Well, we really appreciate you being on the show with us tonight. And I guess, because you talked about the neurological part of that, of being a chiropractor, can you explain a little bit about what that means? Yeah,
there's, like in medicine and chiropractic, we have different specialties that a chiropractor can do once he has his doctorate degree in chiropractic. One of them is called chiropractic neurology. It's an American specialty. And it allows the chiropractor to be able to examine a patient neurologically to see what parts of the brain may be working well, what parts of the brain may not be working so well.
Oh, wow. Okay.
And with that in mind, with a working plan in mind as to what may be going on with the patient, we will develop certain types of exercises to activate different areas in the brain. We might get into some nutritional recommendations. And the whole idea is to really stimulate or improve the function of the brain. The specialty is often called functional neurology as well.
Okay. So for like a patient of yours, when you said that you might come up with certain exercises, because I know, for example, when you're an osteo, sometimes you get almost like homework, like you got to go home and do your homework. So is that the same situation?
Absolutely, absolutely. So it's really amazing how if you can give a patient a specific exercise, we know that if certain types of movements will activate certain parts of the brain. So if you can figure out what part of their nervous system isn't working quite well, you can then give the patient homework to do at home and then reevaluate to see if this is working or not.
And can you just elaborate on the homework, quote unquote, because I know it's very easy for people to, go see someone like yourself, or even let's say they were going to physio or what have you, and then you're given homework and then you don't follow through. So how annoying for you, because you have to tell them what to do, but it's important to do the homework.
Sure. I hear that, and I think I'm lucky that I think my patient compliance is quite good.
I love compliance. It's a good word.
I think when people are really suffering, and very often people with neurological conditions are, when you're giving them some sort of hope and an explanation as to how you can help them, they are very motivated to do what you suggest. Okay, great.
So Dr. Jean-Pierre Morissette joins us now. Hi.
Hello.
So you're here and ready to rumble.
Ready, yes I am.
So we'll have the phone lines are open. You can join us at 514-790-0800 by phone, and of course by text at 514-800. Dr. Freud, can we start by asking what what is a concussion? Because that's sort of like the word du jour with, everyone talking about hockey and obviously football. That's a concern right now. I think it's like the buzzword the last couple of years.
It sure is, and it really affects a lot of people, from the young who are involved in sports to older people, even the elderly who may have a fall and hit their head. A concussion is basically an impact to the head. It's a brain injury.
Okay.
First of all, it is an injury to the brain. It can occur from an impact to the head. It can also occur from any sort of jarring of the head. So a car accident, for example, where you might get a whiplash, a fall, even a body check in hockey, for example, anything that might jolt the head around.
Yeah.
And basically what happens is, I'm sure you've seen these crash test videos with the mannequins, how they continue to move after the car hits the wall. Mm-hmm. Really, the same thing happens inside your head. So the brain continues to move inside the skull.
Okay.
And we know that the brain is really a soft organ. It's about the consistency of jello. So as it moves inside the skull, it can hit the inside of the skull. We know that it can twist, it can elongate.
Wow.
And just as if you were to hit, your thumb with a hammer, the same thing happens inside your head. You get an inflammatory reaction, you get inflammation, and you can also damage the nerves that are inside the brain.
When it comes to concussions, is it more dangerous for a kid or a young adult versus someone older? Is it vice versa?
Yeah, the research actually shows that adolescents are the highest risk of having difficulty recovering from a concussion.
Okay. Wow, because you always hear when someone gets injured that, it's lucky if you're young because you'll, like with a bone break or whatever. So it's kind of the opposite when it comes to this specifically. There
is what we call plasticity. In other words, the brain is able to rehab itself. And this goes back to what we were talking about with the exercises. But adolescents really tend to have the hardest time.
Wow. 514-790-0800 by phone to reach us here. And of course, 514-800 by text. We've had a text come in. My daughter is a national diver. Lots of her friends have gotten concussions. How long should they wait until they train again?
That's a really good question. In fact, the hallmark treatment for a concussion, the first thing to think of, it's, the brain is like any other part of the body in a sense. And if you were to sprain your ankle, the first thing you want to do is rest it. So I would imagine that that's already been done. You want to rest the brain in a physical manner, which means no sports. You want to rest it in terms of mental activity, no screen time, no reading, for example. Now, there are different protocols to use, generally referred to as return to play, in that the rest periods are then followed by mild stresses. So depending on what the problem is exactly for a diver, for example, maybe you could have her start swimming a little bit, see how she reacts. If she reacts well, we monitor her symptoms. If there are no symptoms, then we push her a little bit more. She could start some light dives. And then from there on, hopefully there's no reactions and she can go back to full diving. Now, if there are problems, there's different ways and different exercises that she could do to help rehab her brain.
When it comes to some of the symptoms of a concussion, Dr. Freud, I know that, we always see those, sports highlights reels where the football player is kind of wobbly or he can't quite get off the ground, but there are more subtle symptoms, I'm assuming, as well.
Yeah, in fact, people can get this sort of a dazed feeling after they get their bell rung, for example, but actually about half of people after they get some sort of impact or a jolt to the head will only develop symptoms maybe 24 or 48 hours later.
Oh, wow.
Yeah. So, I sometimes use the analogy. It's like if you were to take your computer out and all of a sudden it dropped out of your hands.
Yeah.
The outside may look okay. You may have a little scratch, but once you plug it in and start using it, all of a sudden you see that things just aren't quite normal. So, the brain is responsible for your reality. It's responsible for what you feel. It's responsible for how you move. It's responsible for how you think. So you can expect a lot of different types of symptoms. We generally categorize them in three ways. So we talk about physical, mental, and emotional types of symptoms. The physical symptoms, the most common ones are headaches and dizziness. Someone could have fatigue, nausea. They often have migraine-like symptoms. They might be sensitive to noise or sensitive to light. In the mental aspect, brain fog, people will often talk about concentration problems, that their memories or memories having problems, slowed thinking, for example. From an emotional standpoint, people can be sad, worried, irritable. They have less control over their emotions. Depression is something we often see with concussions as well. And sleep is another thing that we often see on the physical side of things. So really any of these symptoms after a head impact or a head jarring can be a sign of a concussion. You don't have to have all of these symptoms, but any one of them with that mechanism of injury can point you to diagnosing a concussion.
A couple of people on the line now at 514-790-0800. We've got Eva on the line from Paincourt. Eva, you have your son has an injury from football?
Yeah, he had a football injury in October. The helmet came off and somebody head first went into him. So he had 33 stitches.
Oh, my goodness.
And he had a CT scan. And they told me that he didn't have a concussion. But I said, okay, fine, but he's still off for another month. And then he started playing again. And halfway through the game, he got hit, helmet to helmet, but side of the head. And he just continued playing for the next 2 minutes because it was halftime. And then when he came back to play, he couldn't remember the first half of the game. It slowly came back, but they told me that he didn't have a concussion. So I don't know. Is a CT scan a guarantee that whether you can see a concussion or not?
That's one thing about diagnosing concussions, that there is no test as of yet that really confirms a concussion. So even with really bad hits, you could take a CT scan, an MRI, you could take x-rays. There's no blood test. The diagnosis really comes from looking at what happened and examining the patient and questioning the patient. So if I'm just to look at 33 stitches to the head by the sounds of the hit that he got, if his helmet flew off.
And then head to head, like the other kid had a helmet on and his helmet had come off and he went head. Like it all happened within like 5 seconds. Helmet came off and the other kid head to head, but he didn't have any nausea afterwards, nothing to say that he had a concussion.
Sometimes,
but then when that happened, when he lost his memory, I mean, that's pretty scary.
Sometimes it's after another concussion that we look back and say, boy, I wonder if he had a concussion, a week ago or a month ago. But just the way you described that impact, I would be very surprised if his brain didn't get jarred inside his skull. And that's really, what we talk about when we talk about concussions. The fact that he lost some memory after the second hit that you described, that's a pretty serious sign, even if it was temporary.
Does he have symptoms now, Eva?
Not at all. Not at all. Like even after he got his stitches and everything, he wasn't sick. He wasn't like no symptoms whatsoever. And I used to be a football manager when he was younger, and I've seen the movies and I've seen all those. Mm-hmm. And his girlfriend took him to see the movie Concussion.
So Dr. Freud, what do you want to advise Eva with regards to this? Like, obviously he seems to be doing fine now. What do you want to leave her with?
There's how a patient feels is part of the equation. There's a lot of things that go on in the body that we're not aware of. And I could give you high blood pressure as an example. You may have high blood pressure and not even know it. You might feel fine, but you go to the doctor and he or she will take your blood pressure and say, my goodness, your blood pressure is quite high. So how he feels is only one part of the equation. The other part is getting examined. So if you're at all worried, I would suggest that you get him examined and go beyond just how he feels.
Now, we were talking earlier, Dr. Freud, about, what exactly is a concussion, some of the symptoms of a concussion, and we know that you deal a lot with the neurological part of being a chiropractor. How is a concussion actually diagnosed?
It's interesting that there is no blood test or MRI finding or CT finding that helps diagnose a concussion. It's really diagnosed the old-fashioned way, with a qualified doctor who We'll take a good history, listen to the patient, perform specific exams, understand exactly the mechanism of what happened during the incident. And, if we can correlate the patient's symptoms with the accident they had, in addition to different exam findings, we would say, well, yes, you do have a concussion.
Okay. Now, we have a caller on the line right now. Anne from Montreal, you have a question about a concussion?
Yeah, hi. I just happened to turn on the radio and heard you talking about concussions. I've been having, I never ever have headaches, and I've been having headaches behind my eye, and on the same side, that muscle that goes behind your neck, all the way down, to your shoulder. I can't figure out why. I thought maybe it's a pinched nerve, but now I'm thinking back. I think in my crawl space, which is about 4 feet or something, I know I did, but now I can't remember exactly when it happened. But I hit my head really hard on one of the beams,
Was that several months ago? Like, would you remember?
Well, I'm thinking within 2 months, and I'm wondering. I'm thinking I kind of put things off and brush it off, thinking, just a headache, but it's just continuing, and this.
So, are you worried it's an undiagnosed concussion? You think maybe?
Yeah, I'm thinking it's a pinched nerve. So I was thinking about going to a massage therapist, like a sports therapist, maybe. But I just said it's every single day I have mild headaches and still this pain, and I've been putting heat and everything.
Dr. Freud, what do you want us to tell her?
The first question is, are you experiencing any other symptoms? Do you have any dizziness or balance issues? Are you sensitive to light or to noise?
Light.
You're sensitive to light, and is that something that you've had before?
No. No, light, and I just don't want to. I can't talk loud, or I don't want to yell at my son or anything, because I think it'll affect my head. Or I just want to be quiet, which is unusual for me.
So those are symptoms of a concussion, of a possible concussion, and you raise a really good point there, where the neck is often involved with hits to the head or with the body being jarred around. So we want to be able to differentiate, is this purely a neck issue from the hit that you had? It may be even something else. Maybe it has nothing to do with the hit on the head that you had. But as soon as you start talking about other neurological symptoms, like the sensitivity to noise or to light, we start thinking that, yes, perhaps there is something more going on here than just a neck problem.
So, Anne, you might want to think actually about taking care of yourself. Now, I did want to ask you as well, with regards to concussions, how do you treat them? I know there's, I guess, different levels depending on if you have a slight concussion or obviously a severe concussion.
The first thing to keep in mind as far as treatment or recovering from a concussion is rest.
Okay.
So as we were saying earlier, if you have a sprained ankle, you want to stay off of it. You don't want to irritate it. When it comes to the brain, resting the brain means no physical activity. It also means no mental activity. So no TV, no iPads, no computer. Just really give yourself a good rest for at least 24 hours, depending on the severity of your symptoms. And then we want to implement what's called a return to play or return to learn protocols, which is basically testing the limits of the brain and easing back into activity or easing back into work or easing back into school in the same way that you would with your ankle. You want to sort of walk on it gently for the first little bit, see how your body reacts, and then next thing you know, hopefully you're running. Same thing with your brain. If the person particularly has physical limitations, say doing a sport, we want to slowly get them back into practicing, monitor their symptoms, see if there's any aggravation. And the idea is to slowly see, as you increase the training, if they can go back to play. You can also do the same thing with learning. So if a child gets a concussion and they can't read without getting symptoms, or they certainly can't sit in class and pay attention, well, we want to keep them home and rest first. Then we want to introduce some light reading or some light screen time, see how they react. If they react well, then we progress on to doing more homework style work at home, see how they react, then slowly integrate them back into school. 80 to 90% of cases with this protocol will be fixed. They'll be back and functioning well within about 3 weeks. For the 10 to 20 unfortunate percentage that don't heal, this is where we really want to have a good examination and see what part of their brain isn't working properly. So you can very specifically target that area of the brain in a rehab way. So for example, if the person is always dizzy, you really want to look at those parts of the brain that are responsible for your balance. So they could be your inner ear, the vestibular system, it could be your eyes, it could be related to your neck as well. There's different research that's been shown that neck problems can actually mimic a lot of the symptoms that we see with concussions.
Okay.
And by helping the neck mechanics through chiropractic adjustments, we can actually relieve a lot of these symptoms or the whole concussion problem completely.
Okay. And, you mentioned earlier, just a few seconds ago, with regards to, you're getting a concussion and you need to rest. You need to rest physically. You need to rest mentally. So no TV, no iPad, all that sort of stuff. People would, I think, go a little bit nutty if they're sitting around for a week. So are they allowed to maybe go for a walk? How much rest? When you mean rest, you mean I need to lie in bed for a week?
That's a very interesting question, because the idea of rest has actually come up lately in the scientific literature to suggest, well, maybe it's not the best thing, especially when you're looking at athletes who love their sport and they're just dying to get back out on the field, for example. So rest is very relative. You have to look at the symptoms that the person has. So for some people, if they have severe symptoms, you may want them to actually stay in bed or at home with the lights dimmed and really just taking a vacation from everything. For other people who may not have such severe symptoms, you may want them to start walking right away and see, just kind of test the water a little bit. So these recommendations are very broad, but you have to look at the specific case in order to get more detail as to what kind of rest you need and how long you need to take the rest.
When it comes to concussion, is it worse if you get nailed in the back of the head, like you fall backwards, or forwards? Like does it matter?
As far as the mechanism of what happens, what seems to be coming out is that the rotation, if there's a rotation effect, that really is the worst. Like
if your neck turns when you fall, let's say fall forward or
exactly.
Okay.
And if you see there's a bunch of Sidney Crosby hits on the internet, and you'll see that one in particular where he really gets flung around. Anything that creates this rotational aspect seems to be the worst type of injury.
Wow. Okay. I'm glad you answered that, because I've always wondered that if it's, because again, certain people have been in car accidents and just all that sort of stuff. And then again, like we've talked about so many sporting injuries, especially, we talked earlier when we were off here about women's soccer and I guess even in men's soccer, like when you're going full pin for the ball, and then if you bump into someone and then you get, I've done the 360, I play soccer, so I know exactly what that feels like. When it comes to, recovery, are there any factors that make it take longer? Like I know you talked about, quote unquote 3 weeks, but
if somebody's already had a concussion in the past, that's one factor that really affects the recovery time, especially if they still have symptoms of a concussion and they get another one. In fact, that could be extremely dangerous. Learning disabilities has been shown to slow down recovery as well. So if somebody has ADHD, for example, or they have trouble learning and they get a concussion, that can worsen the prognosis. It can be a little bit more difficult to treat. Emotional problems as well. So someone who has a history of depression, for example, or anxiety, these people will also have a slower recovery in general.
Is there anything to say to someone like, because we were also talking about some football players, and I know obviously hockey players are in that sort of league as well, but like a Junior Seau, who I think they made note that he had those brain injuries, and Frank Gifford, the legendary New York Giants player who recently passed away, and they've just sort of figured out that he had CTE. Can you explain what that is, and is there something you can do about it as a chiropractor?
Sure. CTE stands for chronic traumatic encephalopathy. It was actually the central theme to the movie Concussion, which we were talking about earlier, and basically what's been discovered is that with repeated concussions especially, there are changes biomechanical changes or biochemical changes in the brain that occur where proteins are being laid down that shouldn't be there. These are the same types of mechanisms that occur in Alzheimer's disease, for example. So there are links that are being made now more and more with research coming out that concussions can lead to more chronic brain problems in the long term.
What would you say to someone who has maybe finished a 10-year career in, football or soccer or hockey, and is there any sort of like preemptive thing to help them through? Because maybe they don't know that they have it. Obviously, if they've had a couple of concussions, it's probably the ratio is more pointing in the direction they're going to have problems. But is there something you could say to an athlete?
The brain affects so many aspects of your life, and it's such a hot topic as more and more research comes out on how we understand how the brain functions, and you see, a host of self-help books on improving your brain health. I think in a very general way, somebody who's had a few knocks in their life or in their career should really pay attention to these things that we know affect your brain, and that is really all aspects of your life, from nutrition, from stress management, from healthy sport and healthy relationships. All of these things we now know can have a dramatic impact on how the brain heals and on how the brain functions in general.
Excellent. Dr. Jean-Pierre Morissette and Dr. Patrick Freud, thank you so much.
Thank you.
It was a pleasure.
It's fun.
Thank you so much for listening. Have a great night.